Hello and welcome to Healthy India. I'm Lottie Alaric. Well folks, I'm back with you once again to take you on this journey of good health. As we all know that we all live very busy lifestyles and sometimes we are not able to look after our own health. So another disorder which is a lifestyle disorder, if you know about it and if you can take care of it, you'll be perfectly fine. So today we decided to talk about metabolic syndrome. To carry this discussion forward, I have in the studio an eminent panel of doctors. I welcome Dr. Sunil, who's the head of the Department of Endocrinology at Max Healthcare. Sitting to his right is Dr. Mitra Basu, physician from Inmas Hospital. And to my left is Dr. Sunil M. Raheja, who's a physician in charge, Department of Nursing at GB Pant Hospital. So I take this opportunity of welcoming all of you to the show.
Thank you. Thank you.
Well, people, before we actually start knowing about this disease in detail, let us all take a look at this report.
Metabolic syndrome is a group of conditions that put you at risk of heart disease and diabetes through obesity. World over, the number of people with metabolic syndrome continues to grow. The increase in this number is connected to the rise in obesity rates among adults. Risk factors are behaviors or conditions that increase one's chance of getting a disease. The more the risk factors, greater is the chance of developing heart disease, diabetes, or a stroke. A person can develop any one of these risk factors by itself, but they tend to occur together. Metabolic syndrome itself usually has no symptoms. Most of the risk factors linked to metabolic syndrome have no signs or symptoms, although a large waistline is a visible sign. Some people may have symptoms of high blood sugar if diabetes is present, or occasionally high blood pressure. Some people are at risk of metabolic syndrome because the medicines they take may cause weight gain or changes in blood pressure, cholesterol, and blood sugar levels. Although metabolic syndrome is a lifelong condition, you can prevent or delay it with lifestyle changes, as healthy lifestyle is a lifelong commitment.
Well, healthy lifestyle is definitely a lifelong commitment, but this is one commitment that all of us find very hard to keep. So I'll start with you, Dr. Raheja. Now, when we say metabolic syndrome, in very simple terms, what would it mean?
Yeah, metabolic syndrome basically means a group of risk factors. It's a group of conditions which increase the person's developing a heart disease. For example, the heart attack is more common in metabolic patients, those who suffer from this 2 to 4 times, and diabetes is more than 5 times more common. In one study it was 5 to 30 times also. It's a group of risk factors which collectively increase the risk for heart disease, type 2 diabetes mellitus, or we can say the adult onset diabetes mellitus, and stroke.
Okay.
And these are few conditions. This syndrome is also called the syndrome X, or you can say the hypertriglyceridemic syndrome, Raven syndrome, syndrome X, dysmetabolic syndrome. It is named by so many terms.
Okay.
And it was only 1980 that this term was defined.
Right.
Even though we knew since 1940 that there are few risk factors which increase the risk of heart disease and diabetes type 2 mellitus. And these were basically the truncal obesity, that is a large waistline, more than 102 centimeters in men's and 88 centimeters in women. And more so the pot belly, or we can say the apple shaped belly, which is more common in Indian population.
Right.
In which we say the waist hip ratio for males more than 0.9 and for females more than 0.85. Second is the increase in the bad cholesterol, that is triglycerides of more than 150. And third criteria, we take the blood pressure of more than 140 systolic by 90 diastolic. The normal blood pressure of an adult is taken as 120 by 80.
Okay.
And fourth is decrease in the HDL level or the good cholesterol, less than 35 for men's and less than 39 for women's. Okay. And beside this, as per WHO, small amount of proteins in the urine, what we call microalbuminuria, and increased insulin resistance, which is reflected by the impaired glucose tolerance or the blood sugar more than normal.
Okay.
Fasting,
so what I'm
more
really
than 1
gathering
time.
here is that this is some kind of a lifestyle disorder. Yes, Dr. Basu?
I agree to your statement, Lottie, that it is a lifestyle disorder, though It is presumably basically you can say the genetics which are ultimately to be blamed. Okay. There are genetic things. Maybe person is predisposed for the development of metabolic disorder in our system. But ultimately it becomes your lifestyle which actually precipitates this thing, this condition, this group of disorders, or this dangerous situation in one person's body.
All right.
So whether its lifestyle is in the form of dietary control or exercise, or you can say stress levels or other things, they collectively can lead to development of this disorder in one system.
Okay, so it means that if a person has been suffering of this condition, so what are the chances of their children suffering of the same condition?
As you know, that if you have increased risk of diabetes or hypertension and high cholesterol, this is called familial. So it's quite common to have this condition in the family. But I think it's more than that, because we South Asians per se, or we Indians per se, have got, as Dr. Basu highlighted, have more risk of having diabetes or high cholesterol or high blood pressure. But when it runs in the family, but it's more to blame on your lifestyle rather than trying to go back on the genetics. So yes, if you have family history, you should be more extra careful. But it can be countered because you can't change genes. What you can do is change your lifestyle.
Right.
So I would concentrate more on lifestyle changes as we have been trying to highlight. And so it's a little bit of everything, which makes this called metabolic syndrome.
So I think it's very appropriate for me to ask you now, people who are heavy smokers, what is the risk that these people face in a condition like this?
Yeah, basically metabolic syndrome, the risk factors are, as we talked, in Indians, it's genetically we are prone to develop the metabolic syndrome. Because we have bad cholesterol level, Indians are more prone to have a truncal obesity, we are more prone to have insulin resistance. So even a normal weight Indian can be a patient of metabolic syndrome, and this incidence increases from the age of 20 to 50. There is a linear increase. Incidence in India is 10 to 15%, whereas the global incidence is 20 to 30%. And again, this it's basically more in certain ethnic groups, from city to city. In Jaipur, in one study, it was 13%. Chennai, it was 11%. So the risk factors which are leading to all this is basically, on top of it, the Indian diet, which is rich in calories. We eat lot of puri, pakoda, samosa, achar, pizza,
Dr. Raheja,
burger.
I'll come back to that because we need to talk about this in a little more detail. But before that, we'll have to slip into this short break. But people, do come back quickly, as we'll tell you a lot more about metabolic syndrome when you're back.
रखते हैं आपके सरोकारों का ख्याल, उठाते हैं आपसे जुड़े मुद्दे, सुनते हैं सबका नजरिया, करते हैं बेबाकी से बात, आपकी आवाज, आपका मंच, देखिए हमारे साथ लोक मंच।
संसद में आता है विधेयक, बनता है कानून, कानून होते हैं आपके लिए, दिखाते हैं आपको कैसे ये कानून आपसे सरोकार रखते हैं। देखिए मेरे साथ संसद से सड़क तक हर सोमवार रात 8 बजे।
Welcome back. This is Healthy India, and today we are talking about metabolic syndrome. So people, if you have a question regarding this condition, please feel free to call us now as our lines are open, and the numbers are 1800115314 and 23035420. So when you call us, keep the volume of your TV set completely lowered down so that we can hear you and you can hear us. Remember, today we are talking about metabolic syndrome. So I'll come to you, Dr. Jha, now. Most of the health conditions or diseases that we talk about, they usually emit some kind of signs and symptoms. So when it is metabolic syndrome, are there any signs or symptoms that one can be aware of?
I would say, unfortunately, they don't have symptoms. Otherwise, people would have walked into doctor's clinic with some symptoms. They are completely a metabolic, means a blood disorders. They don't cause any symptoms.
Right.
So you have to get your body mass index or height and weight ratio, waist size, your blood pressure, and as we highlighted earlier, you need to have your fasting lipid profile, your cholesterol level test, and your sugar level test, and after eating glucose, blood sugar test. And so these are at least basic blood tests needs to be done besides a urine routine test and sometimes more specialized urine routine tests. So these needs to be tested on a regular basis. Then only we can identify these disease process, or we can be called a metabolic syndrome, or we can identify diabetes or hypertension or high cholesterol. So these are basically a disease. All these complex, these simple disorders look simple, but all combined together makes a more, I would say, I can use the word time bomb, makes a most risk of heart disease.
So
asymptomatic disease, blood pictures disorder, you have to get your every blood pressure and body mass index test, then only we can diagnose it.
Right. Well, people, so unfortunately, as Dr. Jha says, that this is one condition where you will not be able to pinpoint the kind of symptoms, because there actually will be no symptoms. So basically, you actually have to look after your health, and you have to have the right kind of lifestyle. Well, now we are joined by Mr. C.M. Jetli from Mumbai. So, Mr. Jetli, if you are there with me, welcome to Healthy India.
हाँ नमस्कार. देखिए, मेरी उम्र है 56 साल
जी.
और जो मेरी डायबिटीज है ना, 40 यूनिट इंसुलिन लेने के बाद में भी खाली पेट 200 और खाना खाने के बाद में 400 करीब आती है. और जो हाइपरटेंशन तो है ही, हार्ट की प्रॉब्लम में दवा चालू है. लेकिन मेरा कहना है कि पहले ना 3 साल पहले मेरा वजन 105 किलो था, उससे मैं अभी 70 किलो पे ले आया हूँ. लेकिन जो बॉडी की बोलता है एप्पल शेप में कोई भी चेंजेस नहीं आया है. तो उसका कैसे बदलाव हो सकता है? धन्यवाद.
All right. इसका कैसे बदलाव हो सकता है? So, Dr. Raheja,
yeah, this we have already talked that genetically we are prone to have a apple belly or the pot belly, what we say, and it is the only way you can control is doing a regular exercise. And if you can do a certain group of exercises with the experts, they can really guide you to decrease your belly also. And at the same time, you have to control your diet, and in diet he has to avoid all the saturated fats. The fat intake should be reduced to 1/3, less than 20% in the diet. The normal Indians, they consume around 50 grams of fat in a day. That should be reduced to 10 to 15 grams.
Okay.
2 to teaspoonful, you can say. And in that we have to have a good quality fat also. In terms of certain oils, like mustard oil is good in omega-3 fatty acids, and you can use the canola oil, you can use the olive oil, and beside this soybean oil, rapeseed oil. All these oils can be used together in combination, and the set of oil can be changed every 2 to 3 months, so that we don't really get out of essential fatty acids. So it's all permutation and combination, but mustard oil should remain as a main oil in your cooking.
Okay.
Third is, if he is smoking, he must quit smoking, because smoking itself can lead to the increase in the bad cholesterol in terms of LDL, and increase the cardiovascular, heart rate, blood pressure, worsen the blood sugar levels. And at the same time, if he is having stress is another risk factor for metabolic syndrome, because more stress can lead to the increase in the certain hormones which we call the cortisol hormones in the body. And even that tends to really increase the deposition of fat, increase the insulin resistance in the body, and thereby leading to the metabolic syndrome.
Well, I hope you're listening to the doctors very carefully, because what is actually coming out of this is that you have to have the right lifestyle. So this is all that we can re-emphasize today in this show. Well, we are joined by Mr. R. Gautam from Delhi. So, Mr. Gautam, if you're there with me, what's your question?
नमस्कार मैम.
जी.
नमस्कार जी.
जी बोलिए.
हाँ मैम, मेरा क्वेश्चन ये है कि डायबिटीज है, ये परमानेंट इसका इलाज है क्या? हेलो.
जी जी, आपका सवाल हमने सुन लिया, and I wish there was.
परमानेंट डायबिटीज का कोई ट्रीटमेंट है क्या?
Okay, thank you for that question. I'll throw this question to you, Dr. Basu.
गौतम जी, डायबिटीज़ एक ऐसी बीमारी है जिसके अंदर एक ही बीमारी में कई बीमारियां शामिल होती हैं। एक किस्म की डायबिटीज़ होती है जो आमतौर पर बच्चों में बचपन में इस तरह की हो जाती है जिससे उनकी पेनक्रियास जो है वो डिस्ट्रॉय हो जाती है। उसमें अमूमन तौर पर यूजुअली पूरी उम्र जो है ना उसको इंसुलिन के इंजेक्शन लगाने पड़ते हैं। तो उसका परमानेंट इलाज तो शायद संभव नहीं है कि भी आपको दवाई छोड़नी पड़े। लेकिन जो दूसरे किस्म की डायबिटीज़ है जो आज के भी हमारी चर्चा में फोकस रहेगा, वो जो एक उम्र 20, 25, 30, 40 साल के बाद जो डायबिटीज़ डेवलप होती है इसको हम लाइफस्टाइल डायबिटीज़ भी बोलते हैं, टाइप 2 डायबिटीज़ भी बोलते हैं, जो हमारे लाइफस्टाइल या किसी और कारण से डेवलप हो जाती है, जिसमें इंसुलिन की कभी कभी ज़रूरत पड़ती है, गोलियों से काम चल जाता है। हाँ, उसमें अगर आदमी अपने आप को डाइट और एक्सरसाइज या दूसरी चीज़ों का अच्छी तरीके से अपने आप को संभाल के रखता है तो उसमें पूर्णतया रूप से उसका ठीक होना संभव होता है।
Right, that's very well explained. Well, first you have to know the kind of diabetes that you're suffering of. Only then the doctors can actually decide what your line of treatment should be and what all precautions you need to take yourself. Well, now we have with us Mr. J.M. Rao from Maharashtra. So, Mr. Rao, if you are there, welcome to the show.
Thank you.
Please go ahead.
My question to the learned panelists is, when according to metabolic syndrome it is not possible to utilize the food consumed, then what about the appetite which will become difficult to be digested for the affected person?
Okay, thank you for that question. Well, first let me ask whether that is true or not. So, Dr. Jha.
So the question is that appetite.
Yeah, but he says that the food that you consume, it cannot be really consumed well. I think that's what he meant.
I do not think so. Whatever, if you consume the God, the way I designed the body, you know, we almost digest everything. I think there was some way that we can design it that, you know, we cannot digest food would have been really better. But unfortunately, everything what we eat, mostly consumable food, you know, and the fibrous food, which is what we can't digest. So if I really convert your question that whatever we eat, which can provide the calories and especially the fat what we have highlighted, makes you more prone to have this, this metabolic syndrome. But when it comes to a fibrous food which we can't digest, which the cows can digest, they are really good for us. So those food we can digest, and if you're eating bad food, that's bad for us. Those who can't digest, which is the high fibrous food, which that's good for us, and that will really, you know, when we say increase, if I feel hungry now, if I eat fruit, say a banana will have 100 calories compared to a 3-4 small biscuit will give me 120 calories. Why I'm feeling, you know, my appetite goes down after a banana because it fills the stomach up and it's got a lot of fiber. It's not providing that much of calories. So if I convert your questions for a more layman's question, I would say, look, those what we eat, digest may not be good for us, but those we don't able to digest are usually good for us. I hope
I'm sure that you made yourself very clear. Well, now we've joined by Narendra from Punjab. So Narendra, are you there? Narendra, can you hear me please? Narendra ji, aap sun pa rahe hain mujhe? Well, we seem to have lost Narendra for the moment, so I'll come to Dr. Basu here. Now, are there any risk factors that one should be aware of? Any risk factors that are connected with metabolic syndrome?
Yeah, Lottie. As we have been discussing, there are some very, we can say evident. And I should say, not as a physician, but as a human being, we all have got an intuition that yes, okay, lack of exercise should be a risk factor for the development of metabolic syndrome. Intuitively, we know these things.
Right.
Okay, if I am not okay with my diet, if I am doing a lot of fast food things and saturated fats and trans fats and other things, that is good, that is not good for my health. So it again becomes a risk factor for development of metabolic syndrome. Then I'm not doing regular my exercise thing. The whole day I'm sitting, or I'm in a profession where it's a table chair job for me.
Right.
Maybe in an office as an executive or somewhere like in IT job, sedentary lifestyle. So that becomes again a risk factor for that thing. Then smokers, as Dr. Raheja told earlier, ki smoking, yes, when smoking can cause your blood pressure to increase, smoking can cause your cholesterol to become bad and other things. So it can lead to development of metabolic syndrome in predisposed individuals.
Right, right.
And yes, stress factors. कि stressful lifestyle may lead to not only a direct disturbance of our hormones in our system, indirectly affecting lifestyle, decreasing the motivation to go for a healthier lifestyle. Again, it can lead to
so it's
obesity
one of those
and
vicious
other things.
circles that we talk about.
It puts you into
Right.
that vicious cycle of these things.
Right.
So these are some common risk factors for development of metabolic syndrome.
Okay. Well, now we have with us Santosh from Delhi. So, Santosh, what's your question?
हाँ, मैं ये पूछना चाह रहा था. हेलो
जी, बताइए.
हाँ, मैं ये कहना चाह रहा था कि मेरी उम्र 45 है और मैंने 2-3 साल पहले चेक करा था कि मुझे डायबिटीज है, लेकिन आज तक मैंने दवाई नहीं लिया. तो क्या ये दवाई लेना, और मुझे ज्यादा कुछ परेशानी नहीं है, तो क्या दवाई लेना जरूरी है मेरे लिए? अपना दवाई के लिए एक्सरसाइज वगैरह से मुझे इफेक्ट?
Okay, very quickly, since we are running short of time, we have to slip into a break. बहुत जल्दी से आप उनको जवाब दे सकते हैं, डॉक्टर रहेजा.
या अगर इनको डायबिटीज़ का 2-3 साल पहले मालूम पड़ा है ब्लड शुगर चेक करने के बाद, तो इनको उसके बाद तुरंत अपने डॉक्टर से संपर्क करने के बाद ये ठीक से इलाज करना बहुत आवश्यक है. शुगर का लेवल इनको रेगुलरली चेक कराना है. इसके अलावा ब्लड शुगर फास्टिंग, पोस्ट पेरंडियल लिपिड प्रोफाइल, एक और टेस्ट होता है ग्लाइकोसिलेटेड हीमोग्लोबिन HB1AC, वो हर 3 महीने में होना चाहिए. और अपने डॉक्टर के साथ संपर्क के साथ इनको शुगर को ठीक से कंट्रोल करना चाहिए. उसके लिए इनको रेगुलर एक्सरसाइज, डाइट कंट्रोल और कुछ जो भी मेडिसिन डॉक्टर बताता है, शुगर लेवल देखने के बाद कितना क्या कौन सा दवा देना है. उसमें कई प्रकार की दवाइयाँ हैं, जिसमें मेटफॉर्मिन भी है, सिक्सक्रिटेगोज भी हैं. उनको अपने डॉक्टर से मिलने के बाद ठीक से इसका संपर्क करके डायबिटीज़ का ठीक से इलाज करना चाहिए. नहीं तो डायबिटीज़ की काफ़ी कॉम्प्लिकेशन है जो कि इनके हार्ट को, ब्रेन को, किडनी को डैमेज कर सकती हैं लॉन्ग रन में.
Absolutely. I hope you've got the answer to your question there, that all you need to do is do not, first of all, don't self-medicate yourself. Go to a doctor and let the good doctor decide your line of treatment. So time for us to slip into another break, but we'll be back in just a moment, so don't go away.
साहित्य भवन की क्या है हलचल, सृजन क्षेत्र में क्या है खास, कोना किताब संग जानेंगे हम, झरोखों से आई किसकी याद। देखते रहिए साहित्य संसार हमारे साथ सिर्फ लोकसभा टेलीविजन पर हर सोमवार रात 8:30 बजे।
आपकी दुनिया, विज्ञान की दुनिया, देश और दुनिया में हो रही विज्ञान और प्रौद्योगिकी की हर खास हलचल का हाल अब लोकसभा चैनल पर गुरुवार रात 9:30 बजे हिंदी में, शुक्रवार रात 9:30 बजे अंग्रेजी में।
और से अस्मिता,
आपकी आवाज हमारी कोशिश।
अस्मिता,
आगे बढ़ना आता है हमें, हमें ना रोको। खुले आकाश में उड़ना चाहते हैं हम, एक मौका तो दो। भावनाओं का सैलाब है अंदर कहीं, इसे बहने दो। हम में भी कुछ बात है, हमें अपनी बातें कहने तो दो। अस्मिता देखिए हर बृहस्पतिवार रात 10 बजे मेरे साथ लोकसभा टेलीविजन पर।
Welcome back. This is Healthy India, and today we are telling you all about metabolic syndrome. So if you want to know more about this, and if you have any questions that's lurking somewhere in your mind, this is your turn to pick up your phone and dial 1800115314 or 23035420, and you'll get your answers right here, right now. Well, having said that, we are joined by Ranjana from Maharashtra. So Ranjana, if you can hear me, welcome to Healthy India.
Thank you, madam. Good evening to you first and to all the doctors, panel doctors. I am a kidney transplantee for the last 21 years and I am on cortisol, glucocorticoid. Okay. I don't have diabetes or anything as such, but I just came to know about from the doctors that if the cortisol levels are high, there is a tendency for metabolic syndrome. Now, since I am a transplantee, I can't leave the corticoids. So how can I take care? How can I take further care? I just want to know that.
Okay, thank you for your question, and well, she seems to be quite aware of what she's suffering of and how she wants to know how should she take
I must say, thanks God that in spite of having such a long history of using steroids, you don't have diabetes, and the chances that you'll develop diabetes will be fairly low. And I understand probably you're looking quite, you seems to be doing quite fit. So in spite of kidney transplant and the steroids, you don't have diabetes. But steroids, what you're doing is a different purpose. So it's a quite life-saving drug for you. And steroids can make you prone to have increased body weight and diabetes, but you get your cholesterol checked done, get your sugar test done, I would say 3 monthly or maybe 6 monthly, cholesterol at least annually, and get your blood pressure checked up so that your doctor can monitor it. You have a little exceptional situation, so we really cannot talk more about you, but it's better to go speak to your kidney doctor who can also look after your metabolic syndrome aspect, and simply a simple blood test, your blood pressure test, can make you understand that you have this metabolic syndrome or not. But yes, please carry on steroids because that's a life saving for you.
Right. Well, now we are joined by IS Bisem from Assam. I do hope that I've got your name correct there. So if you're there with me, what's your question?
I have
please go ahead.
Test report of my blood sugar. This fasting plasma glucose is 102 mg per dl, and the postprandial is 112 mg per dl. Is it sugar in my blood?
Well, that's a very simple question. So do we have a simple answer?
I think the blood sugar levels are within the normal range. Fasting blood sugar less than 110 is taken as normal, and postprandial less than 180 is taken as normal. Anything between 110 to 126 fasting glucose blood sugar levels are taken as impaired glucose, and anything between 180 to 200 is taken as impaired postprandial glucose blood sugar levels. So what I feel is his blood sugars are normal, and he should continue with a good lifestyle and make sure that it remains within this range.
That's right. That's, I think, of utmost importance to see that it remains within that range. Now, Dr. Basu, I'd like to come to you here. Now, since we've just learned that this is one condition which is totally asymptomatic, so does it mean that people who are not overtly, overweight or who are not obese, are these people also at risk? Can they be at risk?
Yeah, Lottie, good question. That was a dark area. Sometimes hearing the word metabolic syndrome, we start visualizing obese people or mota people. No, it's not like this. Metabolic syndrome by definition may happen in a person with totally normal weight. Totally BMI may be within the normal range of, let us say, between 18 to 24, 24.9, and the person may be suffering from metabolic syndrome because obesity or overweight is not an essential criteria for metabolic syndrome. So person may be suffering from hypertension, maybe blood pressure may be about, say, about 130 to say 90. His triglycerides level may be, say, 160, 170. His HDL may be, say, 30, 35, less than, say, 40 or so. And so by definition, he becomes a metabolic syndrome person. And blood sugar, yes, their blood sugar may, as Dr. Raheja says, may be more than 110 and less than 126 fasting. So technically, he becomes a person of metabolic syndrome, even if he is underweight, I will say.
Well, so you've managed to confuse me nicely and properly. And let's see what the next viewer has to say. This is Anant Kumar from Faridabad. So Anant, if you're there, welcome to the show. Yeah, please go ahead. All right. We have lost this connection, and I think Dr. Raheja is wanting to say, I wanted to add to that.
He has told that normal person, metabolic syndrome is common in 5% of the normal persons. And in obese, the metabolic syndrome is to the tune of 22%. Those who are overweight. And those who are obese, by definition, metabolic syndrome is up to the tune of 60%. By that we mean, once the person normal body weight is taken as height in centimeters. Like if a person is 5 feet 4 inches, the height in centimeter becomes 160 centimeter. So the normal weight of the person will be 60 kg plus minus 2 kg.
So this is for men or for women, or is it
for men?
All right.
For women it is less, for minus 4.
Okay.
So if we take that, and by that we can calculate the body mass index, what we have been talking of BMI time and again. I think viewers should understand what this term is. BMI, we mean that we divide the weight of the person by the height in meter square, that is the body surface area, and by that we calculate the body mass index. And if the BMI for Indians have less standard than the Western people. For Indians, we take normal BMI, body mass index, anything between 18.5 to 23.
Okay.
And 23 to 28 is taken as overweight, and anything more than 28 BMI is taken as obese, and anything more than 33 is taken as severe obesity, and anything more than 38 morbid obesity. For Western standard, we can add 2. If we go to the Western literature, they say up to 25 normal, more than 25 to 30 is taken as overweight. So, if we take that into consideration, we have noticed that metabolic syndrome tend to increase in those people who tend to gain more weight after the age of 20.
Oh, all right.
So, it is very important for our younger population, for our teenager in the school and colleges
to watch out,
take care of their weight and avoid eating junk food in terms of pizza, burger,
or
and
any of the other
puri,
things
pakoda, bhatura, whatever they eat.
Right.
And they must maintain a good healthy lifestyle from the teenager age, rather I will say from the childhood. Because
so, which means that parents should actually see to it that they inculcate the right habits in their children. So, once they reach their teens, they do not fall into this trap of all the junk food that we see around these days. Well, now we have with us Gaurav from Delhi. So, Gaurav, I've kept you waiting for quite some time. What's your question?
Thank you for the doctors for telling us about such an important disorder which is prevalent. My if despite losing weight by about 10 to 15%, if a person is not able to bring his blood pressure or cholesterol levels under control and lifestyle modification including diet, then does it necessarily recourse to medication? And if that be so, then he has to take medication throughout the life. That means there is no cure of if you have 1, 2 or 3 symptoms of metabolic syndrome present, recourse to medication is throughout life. I mean, there is no cure. I would like to know that. Thank you.
Right. That's a very good question, I think, Gaurav. So, I'll just ask Dr. Jha to reply.
I think if you have done that, that's a wonderful job. 15% weight loss, that's what we recommend, 7% weight loss, that's a wonderful job. Now, if you, as we are highlighting, if your body mass index is less than 23, and your waist size in male is gone below 90 or below 80 centimeters, if you first thing is try to achieve that. If somebody has achieved 15% weight loss, try to go down and achieve the ideal body mass index and waist size. If you're not able to achieve that, I think it's a chronic disorder. It cannot be, if after significant reduction, if you're not able to do it, if cholesterol or sugars or blood pressure is high, we need to treat it. And the treatment usually is a long term, because you're not going to be younger, you can't do further weight loss, and your metabolic pictures won't change, because there are certain genes, which Dr. Basu highlighted earlier, is driving your metabolic pictures. So yes, you would require a treatment. Yes, you would require most likely a lifelong treatment, because it's what you call is a chronic progressive disease process.
Right. So, Gaurav, I do hope that your questions have definitely been answered. Well, so I'll come to you here, Dr. Basu. Now, we have been talking about the condition and how asymptomatic it is and all that. But I'm sure there is a battery of tests that you would run as a doctor to find out and to establish whether the person does suffer from this condition or not. So, for the common man, how must he or she understand what are the tests that you would actually run?
Yeah, see, even if it is a asymptomatic disease per se, but there may be some symptoms like obesity per se may be a symptom. Yeah. The person feels that he is overweight or obesity, so it becomes a symptom. Sometimes this slight increase in your blood pressure may lead to some dizziness or headaches. So person should actually go to a doctor to get the blood pressure checked up. Or if a person has got a history of in first degree relatives, first degree relative means your parents, siblings or children. If any of them, they are suffering from say hypertension or diabetes, these maybe obesity, it runs in family. So person should go, now they say as early as at the age of 20 should go to a medical doctor just for routine investigations. And usually doctors, they know what they have to do, especially for metabolic syndrome. Doctor will definitely check the blood pressure.
True.
We definitely check the height and weight to calculate the BMI of a person. And if a body mass analyzer is available with the doctor, he will like to check the percentage body fat in one system. Then waist and hip ratio will be checked. Then blood sugar fasting, and after consumption of amount of, they say about 75 gram of glucose is given, and then after 2 hours of that thing, the sample is usually taken. Sometimes persons who doctors suspect, they are highly suspicious that person may be suffering from metabolic syndrome because of the family conditions, lifestyle and diet things. Sometimes insulin levels, they are also checked in a person's system.
So which means basically a routine check for just about everything.
Yeah, and fasting cholesterol, good cholesterol, bad cholesterol, triglycerides.
Right,
they are just, see, list is not very large. They are just very simple and they are very cost effective tests. So these are the preliminary
well, people, you must remember that the tests are not as many as they sound, and yes, they are cost effective, as Dr. Basu has just said. Well, now we just have time to take in Naresh from Chennai. So Naresh, very quickly, what's your question?
Yes, my question is, hello?
Yeah, please go ahead.
Yes, I'm 37 years old. Yes, I'm a bank internal auditor, but I could not find the time for going in the morning and the evening walking because of work pressure. And my weight is 83 kgs, and my height is 5.5 inch.
Okay.
Please advise me how to lose my weight.
Pardon me?
How to lose my weight.
How to lose your weight? Well, I'm afraid that you'll have to wait right now for some more time, because right now we need to slip into a break. But when we come back, we'll take your answer then. So don't go away, as we'll be back in just a moment.
There is an indefinable, mysterious power that pervades everything. I feel it, though I do not see it. It is this unseen power which makes itself felt and yet defies all proof, because it is so unlike all that I perceive through my senses. It transcends the senses, but it is possible to reason out the existence of God to a limited extent. Even in ordinary affairs, we know that people do not know who rules or why and how he rules. And yet they know that there is a power that certainly rules.
Are men from Mars?
And women from Venus?
Who is the better half?
Who takes the decisions?
Who is responsible?
Who is demanding?
Who is submissive?
Who is independent?
Can men and women ever find common ground? To find out, watch Gender Discourse every Thursday, 4 p.m. only on Lok Sabha Television. Welcome back. This is Healthy India, and today we are talking about metabolic syndrome. Well, before we went into the break, we had with us Naresh from Chennai, who wanted to know his ideal weight and how should he go about achieving it. So I'll direct the question to Dr. Raheja.
Yeah, as he has told, the weight is 82 kg and the height is 5 feet 5 inches. That is 163 centimeters. So the weight of this person should be 63 plus minus 2 kg.
Okay.
65 maximum. So he must achieve the normal body weight, and that, you know, it's a very simple method. Weight basically depends on what calories you are taking and how much calories you are spending.
Right.
So if you are taking excess of calories in the form of diet, if he is taking the visible fats like puri, pakoda, samosa, because every gram of fat contains 9 calories. So the simplest way to control your calories intake is put your visible fat out of the diet plus free sugars, because every gram of sugar contains around 4.5 calories, and that they don't have any vitamins or anything else to add. So first of all, he has to make sure that he cuts down on calories intake, and he should start eating high fiber diet. He must take fruits in terms of apple, mosmi, oranges, those who are rich in pectin and fiber. And beside this, he must do regular exercise. And regular exercise, we recommend minimum of 30 minutes of exercise 5 days in a week. That is minimum. Ideally, it should be 60 minutes for adults. For children, we recommend vigorous exercises more than 1 hour. So, if he has to do a moderate exercise in terms of walking, cycling he can do, jogging, swimming or whatever game he likes. In
So
terms of badminton or
indoor
he can do some treadmill, he can do some dumbbells in terms of moderate weight 2 to 5 kg in sets of 3. Giving a interval of 1 minute.
In short, I think Naresh, if you've heard Dr. Raheja, I think he's given you enough variations. So even if you do 50% of them, I think you should be on your way to good health. And since you're living in Chennai, the kind of food that you all have is not really so fatty as the way we people eat in North India. So I think you can be taken care of very well. Only you have to do whatever you're doing a little more intelligently than what you're doing now. Well, finally, we have with us Arun from Indore. So Arun, if you're there with me, welcome to Healthy India.
Hello.
Yes, please go ahead, Arun.
Yes, I'm Srivastav from Indore.
Okay.
My missus is chronic diabetes. And in the last October, she had got that angioplastic.
Okay.
So her creatinine is increasing.
Okay.
At present, it is 3.7. So I would like to know that what is the reason to just increase of the creatine, and it is connected with the diabetes or the operation of angioplastic.
All right. Thank you for that question. So, Dr. Jha, can you answer that, please?
I think what you're saying, the creatinine, I must say that I should not be diagnosing chronic renal failure secondary to diabetes, but I think that's what it looks to be. I must visit your doctor, must visit a physician or maybe a cardiologist that he's done the angioplasty or nephrologist or kidney specialist, because the creatinine levels are quite high. And you must contact doctor. Can it be resolved? It's very early for me to say, but yes, diabetes per se, I'm not talking about your wife, Mrs. Srivastav, I'm talking about diabetes per se after significant years, 10 years, can lead to what you call is diabetic nephropathy, marked by increased leak of proteins from the kidneys and rise of creatinine. And it may have been some role of some test can also precipitate this kidney failure. So you must contact your doctor immediately if you have not done so far.
All right. Well, so that's what you need to do. Actually, you need to take your wife to the right doctor, and only he or she will be able to diagnose and then treat accordingly. So now, finally, Dr. Basu, when we talk of the treatment of metabolic syndrome, what all does it entail, and how does one go about? Are there any stages of the treatment?
Yeah. See, most of the cases, they are treated by just your lifestyle. We used to say that this is a condition of a middle age, like 40 years male, they suffer from metabolic syndrome. So we should take lessons from Bollywood in that case, I would say. Earlier, biceps were in fashion in Bollywood, now this is 6 packs. Right. When our Khans at the age of 40, they can show their 6 packs, why not an average Indian male?
Easier said than done, but yes, we can try. People can
try.
So
we should get that motivation at least. Right, yeah, right. So this is possible at even that age. So you are exercising, then a strict diet control, and I should say it's a total your introspection of your lifestyle in toto. What are you doing, what are you thinking, what you should do, and where you are going ahead.
Right.
A slow increase of 2.5 kg per year. Maybe you are heading towards metabolic syndrome. Slowly, so this is when the age increases, your weight slowly increases. No, it's not like this. It means you are predisposed to metabolic syndrome. If despite your all efforts, you feel you are not able to lose weight, you are not able to control your sugar level, you are not able to control your cholesterol, or maybe you are genetically predisposed, you should consult a doctor. Some patients with what we call insulin resistance or sometimes thyroid disorders, they have got a resistant weight gain. Even if they try to reduce their weight, they may not be successful.
Right.
So when they visit doctor, yes, they prescribe even some medicines apart from lifestyle change. Some people they ask you, okay, if liposuction and other techniques which just take out fat from your system, will it? No. Answer is strictly no.
None of those surgeries are going to
help in this condition. They will not reduce your risk for against the development of diabetes or your coronary heart disease or your stroke, risk of stroke. Liposuction will not reduce that thing. But yes, in extremely obese people, sometimes what we call a bariatric surgery or other surgeries, in long term, yes, they can reduce the risk because they will reduce your weight. Sometimes person becomes free of diabetes and other things. They have got some advantage, but not a liposuction things.
So that's just a cosmetic procedure.
Yeah,
anyway.
It's just a cosmetic. Yes, there are some medicines available which doctor prescribes, which can reduce the levels of insulin resistance, which can improve your blood sugar levels, which can improve your blood pressure levels, which can improve your cholesterol levels. And they have to be taken on a very long-term basis under monitoring. And they are very, very simple medicines. So there is a treatment available for metabolic syndrome.
All right. Well, so finally, would you want to add anything? What is the take-home message that you would like to give to people?
Yeah, I will just give a message to everybody: eat well, sleep well, do regular exercise, avoid hurry, curry, and worry from your diet, from your life, and live a healthy life.
Right. So, Dr. Jha, anything that you would want to add?
I think I'll call it what I call is cage to plate theory or farm to plate. So, whatever grown on the earth comes to the plate straight is good for us. What's packed, processed is not good for us. So, for example, you're taking a roti is good, naan made of maida is not good. So, if you have biscuits, not good. If you have oranges, what's lying on the thing, that's good because straight from the plate. So, do not confuse a lot. Right. Whatever eat well, exercise well. No, it's difficult. As Lottie have been highlighting, it's difficult to lose weight. Just forget about the weight. Exercise, good, so A, B, C. So if you're not able to lose weight, forget about it. Do exercise, carry on doing, good eating, at least you're sorted B and C, A would come eventually. So just that's the take home message, just because we stuck with the weight, we're not able to lose weight. There are studies which have shown that
just a healthy lifestyle is the answer to this condition. Well, now very quickly, just go through this list that we have, whatever the doctors here have just said. It's kind of a recap, especially of the diet. So take a look.
Other names for metabolic syndrome are Syndrome X, Insulin Resistance Syndrome, Dysmetabolic Syndrome, Hypertriglyceridemic waste, and Obesity Syndrome. Metabolic syndrome is diagnosed when a person has at least 3 of these heart disease risk factors: abdominal obesity, higher than normal triglyceride level in blood, lower than normal level of HDL cholesterol, higher than normal blood pressure, and higher than normal fasting blood sugar or glucose. The causes that can be controlled include obesity, lack of physical activity, insulin resistance, and some causes that cannot be controlled are old age with a chance of developing with age and genetics. Specific types of treatment includes weight loss, healthy eating plan including whole grain cereals, fruits, legumes and fish, increased physical activity, smoking and medicines.
Well, I hope you got that in a nutshell as to what metabolic syndrome is all about and how it can be tackled. So do let us know as to what you think of these shows and especially about today's episode. For that, you'll need to write to me, for which my address is
Healthy India, FB 116, Lok Sabha Television, Parliament Library Building, Parliament House, New Delhi 110001. Email healthlstv@gmail.com. And our toll-free number is 1800115314.
Well, your feedback is definitely important, so keep writing into me. Well, let me thank all 3 of you for coming today and for telling us a lot about this. Well, people, as the doctors have been saying all along, that this is one condition which only requires lifestyle modification. As one doctor put it, just remember to eat healthy. Don't bend backwards just to lose that weight, which may be very difficult or sometimes even impossible. Eat healthy from the farm to the plate. I think that's the phrase that you need to take back home today. With that, it's a wrap-up of today's Healthy India. I'll see you next week with another engaging discussion. Till then, this is Lottie Alaric saying goodbye and take very good care of yourselves.
23 जुलाई 1906 को मध्य प्रदेश के झाबुआ जिले में एक छोटे से गांव भावरा में जन्मे थे भारतीय क्रांति जगत के महान सेनानी चंद्रशेखर आजाद। स्वावलंबी और क्रांतिकारी विचारों वाले थे। उनकी मां जगरानी देवी गांव की भोली भाली और सरल महिला थी। आजाद की शुरुआती शिक्षा बनारस में हुई। यहीं वो चंद्रशेखर तिवारी से चंद्रशेखर आजाद बने। इनके क्रांतिकारी साथियों में सरदार भगत सिंह, राम प्रसाद बिस्मिल, अशफाक उल्लाह खां और राजेंद्र लाहिड़ी प्रमुख थे। इनके क्रांतिकारी दल में सर्वधर्म संभाव का वजूद था। यही कारण है कि इसमें किसी तरह की सांप्रदायिक कट्टरता नहीं थी। इन दीवानों का एक ही मकसद था, अंग्रेजों को देश से बाहर करना।
सरफरोशी की तमन्ना अब हमारे दिल में है, देखना है जोर कितना बाजुए कातिल में है।
इनके क्रांतिकारी जीवन में काकोरी कांड, ब्रिटिश वायसराय पर हमला और लाला लाजपत राय की मौत के लिए जिम्मेदार पुलिस अधीक्षक सैंडर्स की हत्या प्रमुख थी। उन्होंने भगत सिंह के साथ मिलकर हिंदुस्तान सोशलिस्ट रिपब्लिकन एसोसिएशन का गठन किया था। आज़ाद रूसी क्रांति से प्रभावित थे। इनका मानना था गोली का जवाब गोली से ही दिया जा सकता है। इनके दल के सारे पर्चे और पंपलेट इनकी सहमति से ही तैयार होते थे। उन्होंने प्रण किया था कि वो जीते जी पकड़े नहीं जाएंगे। इसीलिए जब 27 फरवरी 1931 को इलाहाबाद के अल्फ्रेड पार्क में अंग्रेजों ने इन्हें घेर लिया, तब खुद ही आखिरी गोली चलाकर उन्होंने शहादत ले ली।
मेरा रंग दे बसंती चोला, माए रंग दे, मेरा रंग दे बसंती चोला, माए रंग दे।
चंद्रशेखर आजाद ने वीरता की नई परिभाषा लिखी। आज़ादी की शहादत के 16 वर्ष बाद 15 अगस्त 1947 को भारत की आज़ादी का उनका सपना साकार हुआ। किसी ने सच ही कहा है, शहीदों की चिताओं पर लगेंगे हर बरस मेले, वतन पर मिटने वालों का यही बाकी निशान होगा।
आवाज फिर आवाज है, कभी बात